United with Christ. Meet local churches with open doors serving throughout the Border Valley community and sharing the truth and hope of God's love and salvation. A presentation by KSCE Channel 38 Christian Television. And now, United with Christ.
Hello and welcome. I am Mary Yoly Moore. Welcome to United with Christ. It is wonderful that you're going to be here with us. However, it is absolutely even better to know that we are united with Christ, especially when we face an unexpected diagnosis of cancer. Yes, that's right, cancer. There are 21 Bible verses for facing cancer. Imagine 21 Bible verses. My favorite one is 2 Corinthians 4:16 through 19. It says, and I'll paraphrase, do not lose heart when you get a diagnosis of cancer. Outwardly, Corinthians says, we are wasting away, but inwardly, we are being renewed day by day. It also tells us not to fix our eyes on what is seen, but to fix our eyes on what is unseen, and that is eternal. Praise God. Keep your eyes on heaven. Well, when a woman is diagnosed with breast cancer, I have experienced when I go speak to people and women who have cancer, they are paralyzed with fear, simply paralyzed with fear. Their emotions are overcome with dread, the dread of the unknown. Then the questions come in the middle of the night. And you know how it is, always in the middle of the night, especially, they say, Lord, I'm so scared. Why do I have cancer? Why do I have breast cancer? Will my breast be removed? What's going to happen? They make their doctor's appointment and they pray that the cancer will be treated without their breast being removed. Then the dreaded decision comes in to remove the breast. In some cases, women experience the loss of their breast just like the loss of a limb. Yes, just like the loss of a limb. After their breast is removed, they're faced with their self-esteem, questions about their self-esteem. How will they look at me? How will I look? Unfortunately, women whose breasts are removed do not know that there is a breast reconstruction surgery. Imagine they don't know about breast reconstruction surgery. Some women are very fortunate, though, because after the removal of their breast, they undergo breast reconstruction surgery. And today we are so blessed, we are so ever blessed to have with us Dr. Ahn Lee, who is a board-certified plastic and reconstruction surgeon and a breast reconstruction specialist. And don't forget, next month is October Awareness Month. And I want to thank you right now. Thank you so much, Dr. Ahn Lee, for being here with us. I really appreciate you taking time from your busy schedule.
Thank you for having me.
We want to thank you so much, and we have so many questions to ask you. And just to make sure that I was asking the right questions, I did ask Dr. Lee to help me along to ask the right questions, because some of my questions, there were just so many. So Dr. Lee, let's start by, let me ask you one of the main things. So when a woman is diagnosed with cancer, what should women be looking for?
Well, it's a devastating diagnosis.
Of course.
So the woman, the patient, should be bringing along a family member or friend to all her appointments.
Oh, absolutely. That's vital.
Because there are going to be many appointments. Mm-hmm. You're going to see the oncologist, that's the cancer doctor, mm-hmm. the breast surgeon, to help you make your decision about what you want to do with your breast, and then also the plastic surgeon if you decide on having reconstructive surgery. So always bring a friend or a family member to these appointments, because so much information will be shared with you and you're not going to remember all that.
Oh, absolutely, absolutely. So when a patient gets this diagnosis, can you walk walk us through what will happen? I mean, that's the first thing everybody wants to know. Well, what will happen, doctor?
So after the biopsy is done to confirm that it is a breast cancer, the oncologist will order blood tests, scans to make sure that the cancer hasn't spread. They also may do some genetic testing to see if there's a genetic component to the breast cancer. So then your sister or daughters may have to get tested to see if they carry any genetic component predisposition for breast cancer. All this is done to get more information about how to treat the cancer, what kind of chemotherapy will be used, and then this will also help guide the patient into deciding what to do with their breast.
Oh, yes. Oh, incredible. Well, when can a woman think about breast reconstruction?
As soon as the patient is diagnosed with breast cancer, she can begin to think about reconstruction. That's going to be something that, should be there from the beginning to help guide the patient on the next steps to do. But all of that is going to hinge upon what the oncologist says, what the breast surgeon says, because sometimes the patient is required to have chemotherapy first, or they can have it afterwards. But again, all the testing and the blood tests will help the oncologist decide on what the next appropriate step will be.
Oh, yes, of course. So, Dr. Lee, why is it important to see a plastic reconstruction surgeon?
Well, you want to see a plastic surgeon at the beginning of your journey because the plastic surgeon will help guide you when you are ready to have breast reconstruction. Also, the plastic surgeon will work with your breast surgeon to give you the best aesthetic result possible. So instead of, if you don't go see a plastic surgeon first, you may end up getting mastectomies first, and then you're going to go through a period without breasts. Nowadays, you can have what's called immediate reconstruction, meaning the breast surgeon can go in and remove the breast, and then the plastic surgeon comes in and reconstructs the breast. So the patient goes to sleep with breast, and the patient wakes up with breast.
Oh, my goodness, it's wonderful. Under the circumstances, takes my breath away. So, doctor, what options are available in this breast reconstruction?
So there are a variety of options available. The most common type is implant-based reconstruction. Those are the implants that plastic surgeons use for, let's say, in a breast augmentation. So the same type of medical devices can be used to reconstruct the breast. However, patients who don't want anything foreign in their bodies or have had problems with implant-based reconstruction, such as infection or scarring that can cause pain, will not want that type of reconstruction. And so another type of reconstruction is to use your own tissue. And the most common type is to use the skin and fat from your belly. It's the same tissue that would be discarded during a tummy tuck, but instead of throwing that away, I use that tissue connected to the blood vessels to recreate the breast.
Oh, my goodness. So if a patient has already had one type of reconstruction, can she have another type of reconstruction?
Yes. She can have, if she's had implant-based reconstruction, she can use her own tissues, and vice versa. It's, whatever we can do to get the patient to that happy point in reconstruction.
Wow. It just, and what is the time frame for this?
Well, that all depends on the oncologist. If they have to have chemotherapy first, they can have it, a couple of months after they're done with chemotherapy. It's different when radiation is involved. I like to wait 3 to 6 months after the end of radiation so that they can have reconstruction after that.
Oh, my goodness. I keep saying that because it just amazes me. So does having breast reconstruction interfere with cancer detection at all?
Absolutely not. So your oncologist will continue to scan you. You're going to go in for your visits, usually 3 to 6 months every time, and they'll examine you and scan you to make sure that the cancer is, maintained or, gone, and it does not interfere the breast reconstruction part does not interfere with cancer detection.
And again, the time frame in that is, say, 1 month, a week, for you to decide. They're monitoring you constantly, right?
Yes. Yeah, so you'll get the clearance from your oncologist.
Now let's talk about money. Does insurance cover breast reconstruction?
Absolutely. It's the law.
It's the law.
But not many women know that. So they think
What
it's...
else do they not know?
They think it's a cosmetic procedure, or they've been misinformed by their physicians, because I've had doctors tell my patients that. And so then they keep putting it off until they decide, let me hear it from somebody else. Let me get a second opinion to see. And insurance absolutely covers it.
And so when they say that you need to go, so you have a counselor there that will kind of show you the way of what kind of insurance to get, or who to talk to, or all of that is there available for you from you or from the hospital, or who gives you this information?
Yes, so when the patient comes to my office, they're given all their information that's needed. We work with their insurance company to get all the authorizations so that they don't have any out-of-pocket expense, and that the surgery is definitely covered for them.
And while this is going through, while you're getting all the okays for the person to get the insurance coverage, they're still going through their treatment, and they're still going to see their doctors. And so what do you hope for in the future of breast cancer treatment?
Well, definitely, hopefully there will be a cure one day.
Yes.
But in the meantime, I'm hoping that this breast reconstruction law that just passed in Louisiana will become national.
Yes.
So that women should know and will know all their options before they make a decision on what they're going to be doing to their breasts.
Absolutely. Now, I know we went through this a little bit too fast. So do you mind if I kind of summarize and go back to ask you some questions, so that maybe now some of us that were out there in TV land are now going to pay a little bit more attention, because this is terribly serious. So let me ask you again, Doctor, when can a woman think about breast reconstruction?
So again, the moment she's diagnosed, she can be thinking about it.
So if she's not informed about this, how, because it is an unfortunate thing that a lot of people do not even know about breast reconstruction surgery. Why?
Well, it's the whole process, and you're seeing so many doctors who may not be on the same page, and so everybody's just doing their part. The oncologist is treating the cancer, the radiation oncologist may, be thinking about the radiation, and then the breast surgeon is thinking about either taking, a part of the breast or the whole breast, and then at the end, the patient is left, in the corner and not knowing what to do.
So many cooks in the kitchen is what I've heard the statement. So many people doing this and this and that, and you're there in the middle just saying, Lord God, how come, why did I get this cancer? Dr. Lee, I'm very curious. Would you mind sharing with us, why did you decide to enter into this field? And I thank you from the bottom of my heart that you did, because, I like men who are reconstruction surgeons, specialists, but some of us women sometimes do prefer to have a female decision. Could you give us a little history of when you decided to enter into this field?
Well, where I trained, breast reconstruction was a very big part of my training. So I was able to participate and perform these types of surgeries on, a weekly basis. And so the GIP surgery, which is the specialized breast reconstruction that I perform, is microsurgery.
Yes.
And so that's just a more intense procedure, more, detailed training, and I just love what I do.
I know you do.
It's, being able to create something from basically nothing is, is a wonderful feeling. And being able to in essence, give the patients their lives back, after their reconstruction is, just a wonderful feeling to be a part of.
Yes, it is. It's always, you're being rescued from a life that, well, some of us would consider not normal. Imagine the loss of a limb. The loss of a limb, all the accommodations that we have to go through. And of course, with the loss of a breast. And Dr. Lee, would you please let us know how many people come to you, and how many people are eligible for this procedure?
Well, I probably see around 200 breast cancer patients in my clinic annually, and the majority of the patients are candidates for, one or the other type of reconstruction. Either you're using your own tissue or using implants. And so, basically all women are candidates for breast reconstruction if they so choose.
Yes, and so is there a certain type of time frame when you've seen where women are affected by cancer more? For example, what time in their lives? Before 30, during 30, after 50?
Well, 1 in 8 women are going to be diagnosed with breast cancer over their lifetimes. And so we see younger breast cancer patients now, less than 30, early 30s.
Goodness.
So I see those types of patients, but the majority of my patients are usually over 50 who have been diagnosed with the breast cancer.
And I know you're not a psychologist, however, somewhere along the line when you are dealing with these victims, these women, I know you console them. So what is the main thing that you tell them to kind of give them, like 2 Corinthians says, do not lose hope. Focus on the unseen. Focus on the future. What do you tell them?
No, just that. Just to focus on the good, focus on the positive. This is a journey, and it can be a long journey.
Yes.
But there is going to be light at the end of the tunnel.
Yes.
And so when we get those patients that have finished their journeys, it's,
Yes.
Open up the wine and champagne, and, there's crying involved, and it's
Yes.
just a happy time.
And then, of course, there are a lot of comforting groups that you get together, and there's a lot of women that have joined together, and they have organizations where they all have had some sort of breast removals, breast reconstructions, and they get together and they give themselves encouragement. And I see a lot of these women that are absolutely going through horrendous problems, but when they join up, when they have a good doctor that cares for them physically and psychologically, they seem to just bounce right back, and they seem to have a very wonderful, happy, normal life. Doctor, I wanted to ask you another question which has to do with, what if the cancer comes back after the breast reconstruction? What happens then?
Well, usually it's, if they detect something, the oncologist will usually order a biopsy to confirm if the cancer is spread. Mm-hmm. And then that will usually mean more chemotherapy for the patient, if that's happened.
And then it's kind of like going back to square one, or?
Yeah, sometimes the process has to start over. It just depends.
Mm-hmm. And do you see that happening more or less than not?
Basically, in my practice, I haven't seen too many patients with recurrences.
That's wonderful. Now, as far as the women reconstruction, I know I'm going to ask the same question again, but why is it that women don't know about this breast reconstruction surgery? I know you answered the question, but it seems to me that, I know you do, that you inform them, but what can we do to help enlighten people with a breast reconstruction that is available for them?
Well, many women don't know, and it's just because of the misinformation that's out there. Mm-hmm. Either from their physicians, mm-hmm. or the, I hate to say this, sometimes the physicians, don't care about that part of the treatment, which is sad.
It's very sad.
But true, because I heard that from some of my patients. and they've been told that they have to wait years for breast reconstruction. They've been misinformed that way also. I always tell my patients they need to just go and do their research, do your homework. And that's how you're going to empower yourself, by having that information. And then when you go back to the oncologist or your breast surgeon, you can say, well, when am I going to get to see the plastic surgeon to discuss about my breast reconstruction?
So that should be one of the first questions that when you are diagnosed with cancer, that breast cancer, that you should ask the question right away about plastic surgery, breast reconstruction surgery, right?
Definitely. That should be on your basic checklist. Oncologist, check. Breast surgeon, check. Plastic surgeon, check.
Yes, but again, we are paralyzed with fear. The fear just takes over you. And so this is why you are saying, make sure that you have your friend with you. Make sure you have family with you. Because as the saying goes, two brains are better than one. Is that?
Yes, definitely.
And then this way they encourage you and they help you ask the right questions, right? And so you say, they already come to your office. Walk me through after that. Okay, they've already been diagnosed with breast cancer. They already had the breast removed. They already are able to get this breast reconstruction surgery. Just walk me through. What do you do? What can they expect?
So when they come to our office, breast reconstruction is what we do, and we pride ourselves in, helping our patients.
Mm-hmm.
So you're going to come in and visit with me, and I'm going to discuss all the available options to you. And I'll discuss the risks and benefits of each.
Mm-hmm.
I'll go through the post-operative recovery period for the type of surgery. But I always tell the patient, it's their choice. The options are all available to them, and they'll make the choice of which one they want to do, and then we can perform that type of breast reconstruction.
So now the insurance has approved the breast reconstruction surgery, and they present themselves, and they're there with you. How long is the surgery?
It depends on what type of surgery they want to have. So with the implant-based reconstruction, they can look at the surgery being around 2 to 3 hours, and then it can be an overnight hospital stay, or they can go home the same day.
Mm-hmm.
The recovery process is easier, of course, with implant-based reconstruction. It's about a 2-week recovery process.
Mm-hmm.
The issue with implant-based reconstruction, again, it might not be for everybody. Some patients, they just don't want to have anything foreign in their bodies. Implant-based reconstruction, it's not a permanent solution. It doesn't last forever.
Mm-hmm.
They will have to be replaced at, 10, 15 years. That is if the patient doesn't develop any complications from
That's
them.
wonderful. 10, 15 years.
Yes.
So after they leave the hospital, they visit you. How many times do they come back?
I see them quite often. After surgery is when I see them, usually the next day. I see them the following week, and then 2 weeks, and then monthly. I see them all the time.
Oh, that's wonderful. And of course, you also have some sort of videos to kind of walk through them so that they can see and expect. People nowadays, they have got to have something visual. And so you do have visuals for them to learn and to see, and pamphlets. I know you have a lot of wonderful information that you're going to leave with us.
Yes.
So that we can share with you all out there. So what kind of videos do you show them?
Well, I have a YouTube channel and my Facebook page.
Oh, you do have a
and
YouTube
we
channel.
talk about different types of breast reconstruction, including the DIEP flap.
Mm-hmm.
And there's just all this information that we have for them that they can research
Yes.
and, do at their leisure.
Yes. And do you have any type of group that gets together, for women that have had their breasts removed and that have undergone breast reconstruction surgery? Do you have any kinds of groups where they can get together and kind of share their woes and encourage themselves?
Sure. So we have who we call our breast cancer patient ambassadors.
Oh, nice.
Who've undergone breast reconstruction. And so when a new patient comes, we always
Yes.
offer the phone numbers to these patients.
Yes.
So that they can talk about their experience and what they went through. And it also, is a bonding moment for these patients.
Absolutely. Not only do they bond with you, doctor, they bond with all the other women because, my sister-in-law went through the breast cancer, and she was never told about the breast reconstruction surgery. I never even thought about it. I mean, it just amazed me one day when I found out about it. And I asked her, and she said, well, it's been almost 5 years. Maybe I should, it's too late for me. Is it too late? Would it have been too late for her?
It's never too late.
It's never too late. So then you contact Dr. Ahn Lee. You make your appointment for a breast reconstruction surgery. She's a specialist. And then, have you seen how some of these women come back to you? Do you see the change in their attitude after their reconstruction surgery?
Oh, yes, definitely.
Immensely.
It's life-changing for them.
Amazing. It's incredible. Well, Dr. Lee, it has been wonderful to have you here with us at United with Christ, and it certainly is a miracle of God that God called you into this particular profession. And I appreciate the fact that you are here with us. We'd like to share a little video that Dr. Lee brought with us so that you can see it, and we hope that you enjoy it. At the same time, I wanted to thank all of you who are viewing United with Christ. Don't forget, we're here for you. Especially don't forget my favorite Bible scripture verse, 2 Corinthians 4:16-19. Always, always, do not lose heart. Look upwardly. Don't look into yourselves. We're wasting away. But look at how we are being renewed. Do not fix your eyes on what is seen, but on what is unseen. Thank you so much for being here with us. We pray for you, and we hold you close to our hearts. Thank you. This is Mary Yoly Moore with KSCE TV, Channel 38. Thank you, and God bless you.